to visit with you briefly about the top 4 reasons that patients don't choose implant treatment when they've been presented the treatment. There was an implant company who did a study several years back, and they polled 500 patients who were offered implant treatment and said no. And it might surprise you, the reasons they said no and the order. Most people right now are thinking the number 1 reason was money, and you would be incorrect. The number 1 reason I'll save, but the number 4 reason was time. In other words, they got confused about the time. How long will it take, or how long will it last? Both of those have to do with time. So when it comes to time and implant treatment, I want you to think this way. When they talk about how long will it last, the truth is it's designed to last a lifetime. With proper implant therapeutic maintenance visits, it's designed to last your lifetime, because that's how implant treatment was designed. It's when we don't get them back on the hygiene schedule and we lose them because they had, some sort of implant supported denture or hybrid, that we lose the opportunity to keep them in our system. So that's one that I want you to think about with time. How long will it take? Well, Miss Patient, it depends on where the implant is located in your mouth and actually how much bone is there to support that implant in a healthy manner before the doctor puts teeth on top of it. So the man-made root has man-made teeth on top of it, and where that tooth is actually the implant, man-made root, is situated in the mouth, determines how long it will actually take. It can take as much as 3 weeks to it can take into 6 months or 9 months, depending on how much bone there is. But stay away from a lot of those in the initial conversation. Now, the number 3 reason was money. And when you think about money, when it comes to implant treatment, I want you to remember a couple of things. Number 1, we don't know where our patients come from. And I will tell you, the main reason people say that it's too expensive in dentistry is not because they think it's too expensive or actually what they've heard, because they know that the reaction when you say it's too expensive is that you'll back off. And the truth is, I teach everything about questions. So I want you to say, tell me more about that, or help me understand. In other words, are we talking about like a vacation, a used Ford pickup, or are we talking about a nice dinner? You have no idea what they're talking about when they say it's too expensive or it costs too much, unless you can learn more about what they're comparing this treatment to. And you can also say, in today's economy, most of our patients are on a budget. What we've learned about our patients who are on a budget is they would rather delay treatment some short period of time and have it done right the first time than to do treatment that they know they risk having done again later. So remember, it's about creating value. It's not always about money, but money is the easiest thing to say for you to back off. The second one is actually fear. And fear is because so many people think that having anything replaced in your body, right, is going to be really, really uncomfortable. So if you can take some of the fear away by saying that most of our patients tell us that having the doctor gently place an implant was less traumatic or concerning for them than it was having a tooth gently removed. Because the tooth does not have a root, right? I mean, the tooth has a nerve, and the man-made root does not have a nerve. So if there's no nerve, there's no pain. Generally, it's swelling, and your doctor will control that with many types of medication. But the number 1 reason, which is interesting, the number 1 reason people did not choose implant treatment is really most important to us, because we do so much and we work so much with how the initial encounter happens on the phone. It was lack of information. Now, lack of information can be a lot of things. We believe that it's the lack of information on a system on how we're going to communicate implant treatment to our patients. When patients call our practice, or any of the practices we work with, we want everyone saying the same thing. Well, what exactly is an implant? Well, an implant's a man-made root. And then what happens? Well, an implant is a man-made root. It's gently threaded into place, and then they put designed man-made teeth to go on top of it. It's one of the treatment options that doctor will discover for you when you're here that day. Now, lack of information can be talking about things that you don't know, because many times in dentistry we want to use our big brain and we want to say things like it's a titanium rod or it's like a molly bolt. I've heard it all. Well, if you want to know more, why don't you just go Google it? We get all kinds of answers when we call these offices and we secret shop. But what I want to remind you is having a simple system, KISS, keep it simple stupid is what they used to say, but really it's just keep it simply simple. And everyone can be on the same page. So getting a system like that for everyone on board to say it's a man-made root with man-made teeth on top of it, at least initially, and it's designed to last your lifetime, is important. Having no system leaves everyone for a free-for-all, and the number one reason people said no is lack of information. Someone didn't know how to answer a question that a caller had. So again, schedule the meetings, set up the systems, and decide what savvy lingo that you're going to use to all these questions.